Welcome to Aging Insights. I'm Melissa Chalker, Program Manager of the New Jersey Foundation for Aging. The Foundation's mission is to enable seniors to live with independence and dignity in their communities. Aging Insights is produced by the New Jersey Foundation for Aging to provide information and resources to boomers, seniors, and caregivers. The primary focus of the program is to provide important information and connect people with community-based programs. Today we're going to talk about fall prevention. We'll be looking at ways to keep you and your loved ones safe at home with information on preventing falls. Falling at home is actually a big problem for older adults. 1/3 of people over 65 will have a fall, and half of those over 80 will experience a fall. The good news is there are ways to prevent them, and there are risk factors you should know about, which is why we are talking about this topic on today's show. In New Jersey, the third week of September is declared as Falls Prevention Awareness Week to coincide with the National Falls Prevention Awareness Day, which is the first day of fall. New Jersey has a statewide falls prevention work group, which is under the Interagency Council on Osteoporosis. Both of our guests are members of this work group. I have in studio with me today Linda Lucuski, a physical therapist and Rehab Director at the University Medical Center of Princeton, and Mary Wagner, Associate Professor at the Ernest Mario School of Pharmacy at Rutgers. Wow. Thank you, ladies, both so much for joining me today about this incredibly important topic. I want to make sure that we're covering all the things that our audience can do at home to make sure that they don't have a fall that could really set them back or hurt them in various ways, which we'll talk about in a minute. So, Linda, I did want to start with you. In the opening, I did reference some statistics about falls, and also that both you and Mary are part of this work group. So can you tell us a little bit about the work group or the Interagency Council and how that came about?
Yes, the work group was formed in 2009, basically to develop and implement a community-based fall prevention workshop with the goal of decreasing falls in not only in the elderly but in all populations, and to educate the public, educate different community groups about the importance of fall prevention.
Great. That sounds wonderful. I'm glad that you're able to be a part of that group and to share your knowledge with us today. In particular, in your role as a physical therapist, you're focusing a lot on balance, right, for seniors and older adults who might be at risk for falls. So can you talk to us a little bit about why balance is so important?
Well, balance is used for all of our activities, everything we do, including our activities of daily living. We get up out of bed, we walk to the bathroom, we take a shower, we make our breakfast, we get dressed. We need balance to perform all those activities. At home, and then of course in the community, when we're out, with the sidewalk may be slippery from wet leaves, icy from snow and inclement weather. So we need good balance in order to be able to do our activities at home, in the community, or at work. And if we have a fall, of course, that will make things so much more difficult to perform our activities.
Right. And you're involved in a program that's called Matter of Balance. Can you tell us a little bit about what that is?
Yes, I am. Matter of Balance is a wonderful program, usually free to the public. It's a series of sessions where the participants will learn basic exercises to strengthen their legs, their arms, their backs, back muscles to become more agile, stronger in their activities. They'll also learn balance activities to prevent falls. They'll learn about ways to use an assistive device, should they need a cane, a walker, how to go up and down stairs, and what interventions they may have in their home to prevent a fall, such as handrails, grab bars, learning to avoid throw rugs and different activities or different objects that may cause a fall in the home.
Right. That's all great. And I know we're going to get into a little bit more detail about some of those things that you've just mentioned in a minute, but I wanted to backtrack a little bit to tell people why it's so important that we talk about these issues, because there are some really great consequences to having a fall, in particular for seniors. Can you talk a little bit about what those consequences might be?
Absolutely, sure. A fall could certainly lead to a fracture. There are many hip fractures that occur due to falls. Hip fractures would cause a hospitalization, more than likely a surgery, with the individual then being more bedbound following the fracture and surgery. That can lead to other problems such as pneumonia and other things much worse than that. So it's very important to avoid falls. A person who has a fall may also be limited in what they can do. That person may not be able to live in their own home after that, which can create many more problems and
Sure.
occurrences.
So you can see why we'd want to work so hard and why the state is focused on, making sure that we have things in place to prevent falls so that these things don't happen to seniors who are trying to live in their home and maintain their physical activity.
Absolutely.
So I think it's great that you've referenced some of these things, and there are things that you can do. You've talked in the beginning about balance and how important that is for risk factors that maybe we can't control, like the weather, if there's ice, or if a sidewalk is uneven. But there are many things that we can control, and there are things that we can do in our own homes to help us prevent falls, right? And some of those things I think are referenced on this great checklist. Is a home safety checklist, which is available on the state's website for this work group, that has some great information. So if you could maybe just go over some of the things you mentioned before, grab bars. I mean, can you pull out a couple of the things that are important to do at home to prevent these incidents?
Absolutely. One of the main things is proper lighting. If an individual is in their living room watching TV and then wants to walk to the kitchen to get a drink of water, go to the bathroom, you need to have lights available, whether a wall light, a lamp. Night lights are very important. If an individual gets up out of bed to go to the bathroom in the middle of the night, a night light is of most importance to prevent falls. Avoid wires, telephone wires, computer wires, clutter that may be in the walkway, such as boxes, packages, newspapers, anything that may cause a person to trip. The use of grab bars, of course, getting in and out of the shower or the tub, railings on stairs, preferably 2 railings if an individual can do that, but definitely at least 1. Be careful of small pets or any pets that may get underfoot, could trip a person. I always tell my patients, look down when you're in the house if you have pets. Make sure that you don't fall over the pet who may be underfoot. Placing non-skid strips in the bathtub. Bathroom is a very highly likely place to fall, so you want to make sure getting in and out of the tub, not only having a grab bar, but using those strips or a mat that's secure, getting in and out of the tub. Consider purchasing a cordless phone, whether a cell phone or a cordless phone that you can have by the bed, even if you need to take it into the bathroom with you or wherever you are. Take it when you go to the mailbox. Many people have mailboxes which are out on the curb, not just outside of their front door.
Right.
Take your cell phone or your cordless phone with you in the event of a fall. You can have a home safety inspection. Usually that will be covered by your insurance company. A physical therapist or occupational therapist could do so with a doctor's prescription to come into the home and look at different things that may be helpful to make the home safer.
I just want to make sure that we're not missing and highlighting that so that our viewers know. So if they're concerned about falls, or if maybe a doctor or someone in their life has said, you're really at risk for this, there are some things you could do, they could ask their doctor for a prescription, for a physical therapist to come out to their home and evaluate and use something like this checklist, where they would look at some of these areas that you're talking about, lighting and railings and grab bars, and really kind of customize a plan for them?
Yes, that is correct.
That's great.
And there are different agencies and even Home Depot and other stores that sell the grab bars, and they could arrange with someone to have those different assistive devices or placed in the home. And
Great. This is all really great information, but I do want to get back to our talk about balance. Because after all, that is sort of your specialty, right, as a physical therapist in doing exercises, and you're going to share with us some exercises that people can do at home and how they can improve their balance and kind of prevent this. So we'll see that a little bit later, where we'll be able to sit down and walk through some of these exercises to really help people, because I think that's important for people to know that there are things that they can do to help prevent these. As I said, there are those risk factors we can't control, like the weather or bumpy sidewalks, but there are things, as you've clearly mentioned, in your home that you can do, and also physically with your health. You could do some exercises to bump things up and make sure that you don't fall, or that when you do fall, maybe your fall won't be as significant because you've built up some strength, and that's kind of the gist, right?
Yes,
I'm not speaking out of turn.
No,
okay,
that's it.
great.
Wonderful.
So I think this has all been really wonderful for you to share with us. Are there any other risk factors or points from the checklist that you want to reference that maybe we didn't hit yet?
Well, of course, be careful of your footwear. You don't want to wear slippers or socks or stockings where you could fall. You need good supportive shoes, preferably that either lace or have Velcro closures. Also, make sure that you have proper eyewear, have your eyes evaluated by your physician to make sure that you can see correctly.
Sure. Sure. There really is a lot that goes into this, so I'm really glad that you're both here to share that with us today, because one of the other things we haven't talked about yet is the role that medication can really play. And so that's what we're going to turn to Mary for. As I mentioned in the opening, Mary is a pharmacist, and she is also part of this interagency council and the work group on falls. And so we're really happy, Mary, to have you with us today to talk about some of these other risk factors, because people, I think, often think about the things we've talked about with Linda, with your physical fitness and with risk factors at home, but they don't often think about the things they're putting in their body, such as necessary medications, obviously, that play a factor in this. So as your role and part of the work group, you've kind of developed this brochure here. I have a copy of it with us here that kind of lays out some things that have to do with medications. So would you mind maybe giving us just a introduction to what this brochure really means?
Okay, so I'll tell you a little bit about how the brochure got developed.
Yeah, that would be great.
So in 2009, the Interagency Council on Osteoporosis realized, if a person with osteoporosis falls, they have weak bones, and a fall is devastating. Those bones are going to break, and you're going to see a lot of comorbidity and mortality and the consequences that we've talked about already. Sure. And we felt it was really important to clear up some of the misconceptions and increase awareness, and also create educational materials that could be part of a toolkit for campaigns for fall prevention. Right. And as we talked about, we have the Fall Prevention Week that we've made a proclamation for, and the committee has created numerous educational materials for that. And this was the first material that was created, this medication brochure, but we've created a number of others that we use for health fairs, and we distribute to the different agencies, community agencies. And there's a big campaign every fall where we distribute a lot more educational materials to them. Right. We do the health fairs where we can have the pharmacist here to go over the information that I'm going to talk about in this handout, as well as do balance screenings, or other healthcare professionals come in and do their risk assessment. So my piece is just the pharmacist is to address how medications are related to falls.
Yeah. That's a really comprehensive background on the work group and how these materials came to be, and it's great. I just wanted to reference real quick that this stuff is available online. So if people go to the state's website and look up fall preventions, they can find all these materials, and we'll be sure to show that on the screen, the website that they can go to, because I don't want to make you recite it, because the state websites are really long. Right? True. But I did want you to tell us a little bit more about the brochure itself, and delve into maybe some of the things people don't realize that are risk factors with medications.
So if you look at the slides in the handout created from this, is that we wanted to simplify the concept, because medications are complicated. There are lots of medications. Seniors are on an average of 6 to 7 medications. Wow. And we know that if you're on 4 or more, your risk of falls is great. Right. So we wanted to create a simple way to say, am I on a medicine that may cause a fall? And we said, we'll just do something really simple. So we created this Standing Tall Against Falls brochure, and we created a mnemonic ABCD. Right. Know your ABCs. Right. And A stands for altered vision, B for altered balance, C for altered confusion, and D for drowsiness.
Okay. So those are things to look out for. If a medication causes those things, it could put you at risk for a fall.
Correct.
Okay.
Correct.
Great. So I don't know if you want to talk about any of those specific ABCs in a little bit more detail. I know when we talked about some of the other risk factors, Linda did mention, getting your vision checked. So altered vision is the A of the ABCs, right, for preventing falls related to medication. So what are some things people should be aware of in terms of altered vision?
So altered vision means double vision, blurry vision, decreased clarity of vision, peripheral vision loss, and this can happen really gradually.
Sure.
And peripheral vision loss is very concerning, because you don't realize what you're not seeing, right, and it can come up gradually. And there are medications that can cause double vision or blurry vision, particularly ones that we have over the counter that have antihistamines in it that people use for allergies or sleep aids. but we have a lot of medical conditions, and patients should really, really have their eyes checked professionally.
I think that's a great recommendation, and you're great to point out that this is not just prescribed medication, that these could be things you're taking over the counter to resolve things like an allergy or headache or something. There are over-the-counter things that we should be aware of what we're taking and what the impact could be on our health and things like our sight and our balance. We have talked a lot about balance with Linda, so I don't want to make you go through all of those things, but that is one of the indicators here. And specifically, what types of medications would people need to be aware of that might affect their balance in addition to their physical capabilities?
The primary one you want to think about is your medications that we use to lower blood pressure.
Okay.
And these medications lower blood pressure, and they can lower them a little bit too low, or they have fluctuations in the blood pressure over the day. And oftentimes patients may complain of dizziness when they get up too quickly after they've been lying down. And so this dizziness can make you unsteady, and it can increase your risk of falls. And it often occurs when you're starting a new medication, particularly the blood pressure medications. And therefore it's important to pay attention to how you feel when these medications start. So the ones that we primarily worry about for balance are our blood pressure medicines, ones that we correct for arrhythmias, ones that we use for pain. And those have a big effect on balance.
Sure, sure. And then confusion is something that you've also got in your ABCs here. Are there specific risk factors or medications that people should be aware of in terms of causing confusion?
And this is difficult. It's basically a loss of awareness around you, lack of focus. And this can come on really gradually. And it's important for caregivers or friends to really pay attention and notice it. It's often difficult for a patient to actually notice it. But it occurs with any centrally acting medicine. Drugs that we use for anxiety or depression, or drugs that cross over into the brain area, like drugs that we use for heartburn or upset stomach.
Interesting. You wouldn't necessarily think of those as things that might alter your cognition or create confusion, but they do. So I think that's important for people to know. And I think maybe hand in hand goes with that is drowsiness. I think that's one of the things people think of often as a result of medication, because so many of them say on the label may cause drowsiness. So why is it important in this particular area to look out for drowsiness?
Well, drowsiness is going to decrease your alertness and your awareness, and that decreases your ability to pay attention to what's around you, and you have an increased risk of falls.
Sure.
And any drugs, that we use for anxiety, prescription pain medications, antidepressants, or anti-seizure medications have an increased risk of making you sleepy.
Wow. So, I mean, I think this is a great brochure and a great information that you're able to share with us today. We've talked a lot about things to look out for in terms of medications and things that they might cause. So what's the most important thing people should take away from that, though, that they should be talking to someone about these risk factors?
Yes, they should have their medications reviewed by their pharmacist at least annually, if not more frequently. They should know what their medications are and why they're taking them. And when you go to the doctor to talk about what your medications are, oftentimes they don't go through a complete list and ask a lot of details. Take the time and be honest about everything you're taking, and tell them how you're taking it and when you're taking it, and if you don't understand your medicines, know every drug has two names, a brand name and a generic name. And sometimes patients get confused and they may end up on two of the same medications. Or the patients don't tell us about over-the-counter products that they take, or when they talk to the nurse that does the initial screen of drugs, they just nod their head yes, and the medication list isn't accurate. Right. So patients should know what their drugs are, why they're taking them, and when they start a medication, start journaling about how they feel when they've initiated this for a couple of weeks, and make sure if they notice any change in any of the symptoms, if they notice any of the ABCDs that we've noticed, to contact their pharmacist and ask for assistance.
Right. And I think that's an important thing for people to know too, that it's not just about calling your doctor's office, that you can call your pharmacy where you got your medications from and actually speak to a pharmacist about some of these things. And they know a lot about how over-the-counter things interact with your prescriptions, and they should be just as aware as your doctor. So we talked a lot about some of these specific medications and symptoms that they may cause, and in that directly talked about also some illnesses that might be a problem. We talked about blood pressure and things like that. One thing we didn't mention that I want to make sure we talk about is blood sugar, and so disease like diabetes. If you have issues with your blood sugar, this could also be a risk factor for falls. Is that right?
When your blood pressure is not right or your blood sugar is not right and you're not in your target range, you're at increased risk of confusion or decreased alertness, and that increases your risk of falls. Okay. So you should know what target range you want these values to be in, have the ability to test at home what your blood sugar is or what your blood pressure is. And if your numbers are not in target range, contact your doctor and have your medicines adjusted appropriately. Right. Because when your blood sugar is low, you just don't feel right, and you have a great risk of falling.
Great. Well, again, I think this is all really fabulous information that you've both been able to share with us, and I think it's great that we can reference some of these things that people can really use to prevent falls at home. Before we go, I did want to reference one more piece of information that's available through the website as well.
Yes,
this is the My Falls Free Plan. So this talks a little bit more in depth about some of these things that we've referenced, and you can have this specified to you, right? So they would sit with a physical therapist, or who would they sit with to fill this out?
Well, a number of the questions are broad range, multidisciplinary. So they have, are you on 4 or more drugs? Are you having various symptoms there? So it can be done with any healthcare professional that knows about fall prevention.
Great. So this is something that once they answer these questions, they could kind of formulate a plan to make sure that they don't have any falls at home.
Correct.
Right? Great. Again, this is all really, really important information I think we're sharing with the audience today, and I thank you both for joining us today. So we're going to do some exercises together.
Okay.
We're going to look at some balanced things that we can show the audience, so we'll leave them with that bit of information. And again, I thank you both so much for this great show. Balance is one of those skills that can be improved if you work at it, which is why we're going to look at some exercises today, and Linda's going to show us some things that we can do to improve our balance and exercises that we can do at home.
Melissa, it's very important for individuals to strengthen their legs to prevent falls. Here are some easy exercises that an individual can do in the home in a comfortable chair. Also, for all these exercises, please make sure that you wear comfortable shoes such as sneakers or a flat shoe with a rubber tread. Also, make sure that you're sitting in a very supportive chair. The first one to strengthen the hip muscles is just sitting in place and marching. Now, depending on each individual's ability, you can do this and count up to 10, take a rest, make sure you're breathing in and out normally. Try it again, do another set of 10. These exercises can be done while watching television, talking with family members or friends. Okay, very good. The second exercise is to strengthen the front of the thighs, the quadriceps, especially important for going up and down steps or curbs. And if you would, please just kick out with one leg and see if you can hold the leg up for just a few seconds. Good, you'll feel that in the muscles of the thigh. If you have any knee pain, please stop and discontinue the exercise. Now, it's also important that we strengthen the lower leg, the shins and calves, for walking and going up and down stairs and doing our daily living activities. So let's just rise up on the toes and then lift the toes, go back up on the heels. And you may want to do them again in a series of 10 or 20. Very good. Remember to breathe normally. If you have any lightheadedness or dizziness, please stop. All right, now let's go on to some balance exercises. I would recommend that an individual does this holding onto their kitchen sink or kitchen counter, nice sturdy support. Okay, the first one is just having the feet apart and just leaning side to side, just swaying and seeing what is my limits? What are my limits of stability? You don't want to go too far that you begin to lose your balance. As you feel more secure with this, you may want to lighten your grip on your support surface. Very good. And you may try that again in a set of 10 or 20. Remember to breathe. The next one is similar, just going forward and back. Again, holding on to the chair or your kitchen counter for support. Very good. Now let's work on some other static balance activities. Let's stand on one foot, see if you can lift the other foot up and balance. Good. Remember to stand tall with this. Don't lean forward. Eyes level. Good. And then see if you can stand there maybe for 5 seconds. Can you do that and let go? 1, 2, 3, 4, 5. Very good. All right. Now let's put one foot in front of the other and see, can you balance that way? This one's a little bit more difficult. Are you able to lift the hands up off of the chair? Good. Again, if you can count to 5, that's wonderful. If you can count to 30, that's excellent. Okay. All right. Let's go on to some dynamic exercises. Let's move. Well, I'll move the chair. Good. And now what I'd like you to do, I'll hold on to your arm for support, but at home, again, please hold on to a wall, sturdy piece of furniture, kitchen counter, and can you walk one foot in front of the other? Very good. All right. Now, let's go back the other way. Can you do a little bit of braiding? Let's face the front. And can you step to the side and then cross one foot in front and then step to the side, cross another foot. There you go. Good. Excellent. Okay, let's go back. The same thing to the other side. Very good. All right, one last one. Again, holding on to your support. Can we do a little bit of a march, almost like you're going up and down stairs? Remember to stand up very tall, breathe. Good. All right, excellent. In addition to practicing these exercises at home, you may also want to look into some of the community programs such as A Matter of Balance, Healthies, or Healthy Bones, who offer different exercise programs such as these. In addition, you may want to look into your local senior centers, YMCAs that offer wonderful exercise programs to help improve your balance, strength, and function.
Aging Insights is produced by the New Jersey Foundation for Aging and is made possible by donations to the foundation. To become a sponsor for an Aging Insights program, please go to our website at www.njfoundationforaging.org or call us in the office at 609-421-0206. All of the previous shows may be viewed on our website. If you we want to remind you to find out about senior services in your area, please contact your county offices on aging. Their numbers are on our website, or you can call the state hotline at 1-877-222-3737. Thank you for watching this episode of Aging Insights, and remember, aging is everyone's business.